then you know I talk a lot about weightlifting and its benefits for health. But I like to make sure that we're doing it safely, and I think there's no better person to talk to than Dr. Kresge. So Dr. Kresge is the director of the Westchester branch of Kinetic Physical Therapy. He has specializations in orthopedics, in weightlifting, in post-surgical rehab, manual therapies. Um, so he's really the guy you want to talk to, and he's the guy that I send my patients to when they're looking to develop a weight training program that's appropriate for them. So there's a lot that we're going to cover tonight, and we're going to try to cover it quickly, but my hope for this video is that it's going to be a resource for people when they, our appointments can be really long in the office, and so often people will leave and they're like, oh my God, we talked for 2 hours, and what was the reasons I was supposed to weightlift again? So I want you guys to pay attention to two things. First, when Dr. Kresge is going over the benefits of weightlifting, I want you to be thinking in the back of your mind, is there a pill that does all of this? All of these things that he's talking about weightlifting doing for your body. Honestly, get out a pen and paper and write it down. See if you can think of one pill or another medical intervention that does all of these amazing things that he's going to talk about, side effect free. And then I want you to think, second thing, how much would you pay for that pill if it existed? What would you do to get it, right? Because we're going to talk tonight, and some of this might seem like, okay, yeah, exercise is amazing. Wow, I didn't know it did all of that for me. But I think a lot of us kind of stop there, and then we don't do the work to take advantage of it. So we're going to cover what you need to do to build an exercise routine that's fit for you, right? Because this is not a one-size-fits-all thing. You have to be really careful when you start an exercise routine. So I am going to invite Dr. Kresge to join. So just give me a second here. And if you guys have questions, there are a bunch of you watching, so if you have questions, type them in the chat box because I'm going to be monitoring the chat while we talk. So a couple things here. So if you're local, so I'm in Exton, Pennsylvania, and can see patients locally that way, but I also see patients virtually from all around the world. But if you're local, you are in for a treat because Kinetic has 2 locations. One's 5 minutes from me, the other's 15 minutes, so it's close. So you can easily get to either location and get Dr. Kresge and his colleagues' help in doing some weightlifting. Hi! How you doing?
I'm good. How are you doing?
I'm good. I'm adjusting. Last time we did this, guys, we both got cut off. So now we're like, can you see me?
We're not messing up. This is perfect. Okay.
I'm going to do that again. Hi! So thanks for joining.
Yeah, we've been talking about doing this for a while again, so I'm excited.
Such an important topic, right? I feel like I tell people all the time that weightlifting is good for their health, and I think people know that, but they don't actually know the specifics. And you have some pretty cool stats that you have talked with me about, and I'd love for you to share with people just a couple things that weightlifting can do for your health and for your body.
Man, well, there's so many. It's hard to just pick one, but when anyone comes in, so obviously I see a lot of people through the lens of rehab, right? They come in and they have an injury, right? And we go over, we go through the examination, we find things that are contributing objectively to have to fix. And usually, many of those things deal with strength, right? The strength is always usually some type of factor when it comes to like orthopedic injuries that happen, right? Or after surgeries or whatnot. So I end up talking to people about strength for a lot of different reasons, but it usually comes through that lens. And besides the fact that it does things like increases your resting metabolic rate, right? And gives you a boost in those good hormones that we know help fight things like depression and anxiety. It really just, whenever I try and sell it to people, I always start with, it makes you more resilient. It's simple. When you're strong and you are more resilient, you are better. You live longer, you feel better. That's the bottom line. So that's usually how I start.
I'm sold.
Right? It sounds.
Yeah. And so I've sent a bunch of patients today who had amazing results. And guys, if you're tuning in and you're some of my patients, one of the reasons I frequently refer to PT is because some of you should be exercising, but you've got injuries that are in the way. But some of the other reasons that I'll refer to PT is to get a custom designed program to help people reverse things like osteoporosis. So can you talk a little bit about building bone, how weightlifting is involved in that? Can you actually reverse osteoporosis with weightlifting?
Yeah. So what happens when we like load our bodies, right? So when we put stress on your body, is your body adapts to that. So vice versa, you've heard, maybe you haven't heard, of stories when astronauts go to space, right? And they're hanging out in space in orbit. When they come back down, they have a significant reduction in their bone mineral density, right? They're very frail because the effects of gravity are much less in space. So they don't have a lot of adaptation to their body. That's why they have to figure out all these weird things they have to do, like run on treadmills and kind of simulate gravity to keep their bodies healthy, right? So us just walking around Earth, the pull of gravity is always on us, so it keeps your bone mineral density at a certain level. You just like walking around the Earth with gravity pulling you down, right? When we incorporate weight training and we're putting more load on our bodies in a regular manner, our body adapts to that the same way. And we start to lay down and create more bone. So people that lift heavy weights, right, whether it's, and heavy is a relative term. It's different for everybody depending on your size, stature, your mass, all that stuff. But when you lift weights and you place extra stress on your body, more than what gravity normally gives you, your bones become stronger and more dense to adapt to support that load. So when people come in with osteoporosis, right, we know they already have a reduced bone mineral density, right? It's often women's post-menopause, or sometimes you can have with other kind of congenital conditions. But people come in, they have less bone mineral density, so they're more at risk for what we call compression fractures. So a compression fracture is what we call a pathological fracture, which means it usually doesn't happen because of a traumatic incident. Sometimes you can get them without falling or getting into an accident or something, right? When you have low bone mineral density, your bones are just less strong, right? So, example, compression fractures often happen in women in the middle of their spines or in their femoral necks. Now, that can happen with a fall, but you can also be doing something like bending over to pick something up. You have weakened bones, you're loading your spine in a certain way, and that can create what we call a pathological fracture, which is that bone was already weak in one of your vertebra, and it ends up kind of collapsing, right? That's what a compression fracture is, and oftentimes people will finally then, after they get a compression fracture, if they didn't know they had osteopenia or osteoporosis, they will go to the doctor and they'll find out that they have it, right? Or they'll come to PT after that if their doctor prescribes it because they have these things and they're more prone for pathologic fractures. Even when you have that loss in that bone mineral density, the same concepts still apply, right? If you load and you put increased load on your body in a graded manner, depending on, how strong you are or what you can do, your body will adapt to that and you will lay down more bone. Now, ideally, this kind of offsets the effects of osteoporosis because as you get older, it can worsen and it leads you to have more or have an increased risk of having a pathologic fracture. But if you are loading your body and your body is, even with less bone mineral density, you start to get your body to adapt to this and lay down some new bone tissue, your bones become more resilient, so you're less likely to fracture your back. And when they've done studies, when you have consistent weight training with osteoporosis, when you go and get that test for your bone mineral density, you can see the opposite effect. You start to reverse to some degree that loss of bone mineral density.
So cool. So guys, there are drugs like bisphosphonates that supposedly help you build more bone, right? But they come with some pretty scary side effects. And so it's worth considering if you have a diagnosis of osteopenia, or it runs in your family, or you are just a person who's never lifted a weight in your life, you could benefit from some kind of weight training program. So I think what blew my mind, I didn't really learn this, honestly, till pre-med. I
Yeah.
knew you could build muscle, right? Like I knew you could influence your body in that way and make your body build more muscle. I did not know that you could make your bones more dense.
Yeah. And if you think about it, like you had said, when you already have that osteopenia, right, which is that pre-osteoporosis, what often happens is, depending on what your lifestyle is, you are already loading your spine in a certain way with your posture. So let's say your back is stiff and you're starting to get kind of rounded, right? If you think about what's going on, your back, right, your vertebrae are kind of in this kyphotic, we call, position. So the force of gravity going straight down is loaded on one end of the spine relative to the other. So you're loading some of those vertebrae more toward the front and more toward the back, depending on which segment they're on your spine, when you have that kind of posture like this, right? Just correcting that, like just doing that, not even doing any weight training, like helping to improve your mobility and load your spine better just when you're standing, the cumulative effect of that years later is also really beneficial for people that are going to have or already have osteoporosis.
You're making me want to sit up taller. Sorry, I'm like, oh man, I need to correct my posture. So, okay, here a couple things I want to talk to the people who are listening. When your doctor is screening you for osteopenia or osteoporosis with a DEXA scan, do it. You need the data. You want to know early if this is part of your picture when you can still reverse it and build that back. You do not want to figure this out after an injury, right? Like you don't want to have to spend years rehabbing something that could have been prevented. So this is why weightlifting is preventive medicine. It not only prevents injury, but it helps you prevent things like osteopenia, osteoporosis. Now, some of you might be listening and thinking, like, this is not a very sexy topic. Like, I care about my bones, but like, what else can weightlifting do for me? So can we talk a little bit about hormones and metabolism and yeah, what else you got?
I think one of my favorite things that I tell people, and this is usually like the guys that I see, right? Because, most guys that come in, whether they're athletes, whether they're just older guys, whatever, you want to be strong. Everyone wants to be strong for sure. But a lot of times we have guys coming in who used to work out and then, they started working and life got busy and they don't have time anymore. And they're like, oh, man, I used to be able to squat this or deadlift that, and I just don't do it anymore. I'm not strong anymore. I feel like I'm, whatever. And they're kind of bummed about it, right? They're like, I just need to get stronger. Or I'll have like a younger athlete come in who hasn't weightlifted at all yet, right? They might be in high school. Maybe they haven't started any kind of training program with whatever sport they're in. And they're like, hey, I need to get stronger. Yeah, I get that. I know. And one of the things I love to tell them, because it gets the dudes super excited always, is I'm like, when you are able to lift heavy weight with these bigger movements, like, for example, a squat or a deadlift, when you can do those movements efficiently and you can start to add on weight and start lifting heavier and heavier weight with those movements, those two examples, the squat and the deadlift, you're using really large and multiple muscle groups, right, in your legs. When you do that, when you are lifting heavy weight, which ACSM would recommend like 65 to 85% of your one rep max, which is basically the most you can lift, right? You have to be in that training zone to create change in your body, right? So it's hard. It's not easy to lift. You're exerting yourself. You're doing sets of 5 to 8, maybe 10, depending on what you're doing, training volume wise. But when you're doing those heavy lifts, right, your body, to accommodate for the stress being placed on it, it releases a lot of growth hormone, right? So there's a whole cascade of things we don't have to get into, but your body naturally releases testosterone and growth hormone, which is used to build muscle, right? And it's also, and those hormones play a big role in many other functions in your body, mood, all that stuff, right? But what happens is when you do these heavy lifts with these bigger movements, we're using all these bigger muscle groups, that growth hormone is released and it's free floating in your body. It's increased for hours after you're done lifting, right? There's just more free floating growth hormone your body can pull from. So whenever guys are like, man, I want to get bigger, I'm like, well, it's kind of meathead science, but it's true. If you want like big biceps, you have to squat heavy weight. That's how it happens, right? You get that release a growth hormone that's flowing through your body that you only get with knowing how to do these bigger movements. And your body pulls from that. And it pulls from that for all kinds of other processes, not just building muscle, right? But when you do those heavy lifts, you're getting this huge effect. And there's a reason that people are not just stronger, but they're like, man, that was a really hard workout. And later they're like, I feel great. Like, I just feel good. Like, happy, I have energy. I was tired, but now I feel good. I slept good. You know, it kind of like when you get in the habit of that, it's an intoxicating kind of feeling.
I love that. Well, guys, there's evidence that after you lift, men and women, your circulating levels of testosterone go up. And men and women both need testosterone for good mood, good libido, building muscle. So there's so many reasons to lift. And if you're somebody who's at home who's like ordered supplements offline to try to boost your growth hormone or testosterone, I want you to hear right now, you don't need to buy pills. You can just go lift. And there's specific lifts that will do this naturally. And something I really love about your program that you designed for people as part of PT and to help with weightlifting is that, like, you can lift really heavy without being exhausted. And I didn't really get that because I feel like I grew up as an athlete feeling like if I didn't leave it all in the field and I wasn't gassed and gasping for air and feeling like I was going to fall over, it wasn't really a workout. And then I did these like very stereotypical like things that women tend to do at the gym, which is like all these classes that really burn you out and get really heavy cardio, really heavy reps. And so to me, it was like, I just lift this thing 5 times for 5 reps and then I'm done. And like, it was great because I feel like I had energy after I worked out, but I was getting better results than I'd ever gotten.
Right.
So yeah, can you talk a little bit about like the difference between reps, like why you lift like for 5 reps versus 25, and just a tiny bit to give people an understanding.
So when you were doing like that lifting you're talking about, right? Did you notice I agree, it's a different type of exhaustion. It's not like I just was sprinting or I played a full game of basketball or whatever, right? I agree. But it's a different type of fatigue. Would you agree?
Yes.
Like it's not the same fatigue, but that's not to say that it is not difficult. It is difficult. It's a different type of fatigue. When you're doing these heavy lifts, and when I say heavy lifts, right, what you have to understand is if you've never done a barbell squat or a barbell deadlift, you will not be able to just go and do that efficiently without probably someone teaching you and showing you how, or you doing a lot of research and figuring it out on your own, right? But like having that guidance, it's not something that if someone just comes in and has, low back pain and doesn't know how to doesn't have any strength in their what we call posterior chain, and I'm like, hey, let's go deadlift, grab that barbell, here we go. No, sometimes it may take like 2 sessions till they are even able to have the mobility in their like hamstrings to perform a hip hinge, to do the things they can do to perform a deadlift. So everyone that is coming in for PT, right, or if you're seeing a personal trainer, right, you're going to be taught how to do these lifts first. It's not something that's super easy that you just get right under a barbell. That's why I always tell people, if you don't know how to do that, you can go on YouTube and find anything these days, but find someone who knows what they're doing to help teach you, because it's way easier when you have someone actually watching you and showing you technique. It's going to make everything easier, right? You're going to just feel better doing everything. But when those people come in, right, and they start doing these lifts, it may take a while till we start getting to that like point where we're starting to load them, right, where they're actually lifting heavy weight. But as that weight goes up and up and up, the fatigue you feel is different in that, yes, you're only doing 5 reps, right? But you have to realize that these 5 reps are within that training volume, that percentage for you, that's pretty heavy, right? So when you're doing a lift where you're lifting 85% of what you could probably do the most of, right, with good form, with reps, and you're using these huge muscle groups to do that, the fatigue you feel is real when you're done. You need 2 or 3 minutes in between each set, right? So it's like, oh, it's only 5 reps, right? But really at the end of it, you've done 5 sets of 5 maybe, which is 25 reps at a weight that's 85% of what you could normally do. That's like a lot. Right? So it's not like it's like you fly through it and you're like, oh, that's it, right? It's a different level of fatigue and your body responds to that differently. It is cardiovascular taxing to some degree, maybe not like sprints, right? But it places a different type of stress on your body. Your blood pressure goes up and down, right, to accommodate for the pressure, like the intra-abdominal force you're creating. It's still difficult to do, so I don't want anybody to think that it's like super easy, but it's
No.
Yeah, it's just different.
Well, and I love that. And I feel like some of my clients, and you guys will recognize this if you're listening, some of you are really burned out and really deconditioned. And like, I had a client say to me the other day, she's recovering from some hypothyroidism, and she's like, I was doing these HIIT workouts and I gained 10 pounds in like 2 weeks. And she was pushing too hard. Like, she wasn't recovering enough. She wasn't resting enough. She didn't give herself the time between sets. And I think that's what I love about your powerlifting programs, is that, they're steady, they're doable, they give you a great workout. It's not going to like push you over the edge if you're someone who's also trying to heal a chronic disorder. They really do strengthen you on every level, which I really love. So let's talk about how to do this right. Because you guys, if you're at home, you definitely shouldn't just like go buy a barbell and start trying to do this in your living room. Talk me through a process of how to really build a safe and effective weightlifting program.
So the first thing you have to do is you have to understand like what your goals are. Like, what do you want to accomplish? Do you want to actually get exercise? Are you just trying to do exercise and want to do something new? Are you trying to actually get stronger? Do you want to be able to do like a certain type of lifting? Like, is it truly Olympic or powerlifting or Olympic lifting? Like, what do you want to accomplish and why, right? Because then you're going to figure out how to strategize to do that. If you want to get the effects of weight training, right, I think powerlifting is, and for those that don't know, powerlifting is like 3 big movements: the bench press, the squat, and the deadlift, right? So 3 big movements. If you're in a powerlifting competition, your goal is to do as much weight as you can for those 3 different movements, and you add up the weight, and your total is what your score is, right? But those 3 movements are full body movements, right, that you have to be able to do efficiently, but they're movements that you do pretty much in your daily life. Everyone has to squat down. Everyone squats down their whole life. People pick things up their whole life. Right? And the bench is a little bit less transferable because it's not a position that you're normally like doing things in, but it's a upper body exercise where you're using giant, really big muscle groups in your upper body, just like the squat and deadlift are. So they're transferable to your like everyday life for most of your life, right? It also teaches you 3 different movements where you have to learn to control different parts of your body. So for example, if you're doing a deadlift, right, not only are you building a lot of strength, releasing growth hormone, feeling strong, right, but you have to be able to do what we call a hip hinge. You have to be able to maintain a stable spine, bend over, have flexibility in your posterior chain, and then turn on the right muscles and lift that weight off the ground up and down, right, and do it effectively, right? Just doing that lift teaches you how to do a hip hinge, how to create stability in your spine, and how to move a part of your body while keeping another part still, right? It's as simple as that. But those skills, you'd be surprised how many people can't do those things because they just never do. They never had to. And one of the things I always tell people when they come in and they're going to do a deadlift is there's always like some stigma that I can't bend over and round my back out. When I deadlift, my back has to be super straight. And those things are true, but I always try and break their stigma that you can't, bend over and flex your back, right? Oftentimes people think that they can't round out their back. Like, that's going to hurt them. They're going to like herniate a disc, or something's going to happen if they like bend over and, try and pick something up. You're supposed to be able to flex your back. Oftentimes that's what we're fixing when someone comes in with low back pain. They have no mobility in their lumbar spine. They can't bend their back. They can't do any of that stuff. We have to separate that from being able to create stability for a task, like lifting something heavy, right? Both those things need to be able to accomplish. And when you are taught to deadlift, you realize both those 2 things. You learn how to control your spine in 2 different ways, right? And that's transferable to everyday life. But get back to your original question, things that like are, I really went on a tangent there, man. Sorry. Things that like end up making or breaking your program, right? Is what your goals are. So then that's going to affect what your training volume is. Do I want to work out 2 or 3 days a week? Do I want to work out 4 days a week? What kind of sets and reps am I doing? Am I starting out with like heavy weight with like low reps? Probably not. Am I starting out with higher reps with more sets and then adding up weight slowly, right? You have to figure out what your goals are, and that's going to have your program tailored to you. The best recommendation I can give people is if you've never been to the gym before, find someone that, whether it's a PT, a personal trainer, athletic trainer, whoever, right? Find someone that can give you some guidance to figure out what it is you want and what goals you have and how to do whatever lifts you want to be able to do. If you're already a lifter, you've been around a gym, but you're not getting the results you want, right? Find someone to program for you. Programming is what you pay for, in my opinion, when you get a personal trainer. You can figure out how to do all these things. You can put a workout together on YouTube and follow 1,000 people on YouTube, right? That'll show you how to do every kind of lift in the book. But the programming, which means how many weeks you're doing it, how many days a week, how many sets and reps, and how you're progressing that and regressing that for how many weeks you're doing it, that is what you're paying for. And that is like where the benefit of having someone else on your team comes in, where they can program for you. So if you're already lifting, find someone that can help program something for you to get you the goals that you want to get to.
I love that. And it's worth checking, guys. If you've been lifting for 10, 15, 20 years, some of the rules around like the anatomy and physiology and the form of your lifts have changed. So like I was surprised to learn from you, Dr. Kresge, like I had been taught to do a squat with my knees facing straight forward. And you actually taught me something that if you have a little bit of an angle, actually it lets you avoid hip impingement. And right. It like my squat. I had no idea.
Yeah, and that, again, that's like a simple fix, right? That someone who like actually teaches people how to squat can be like, hey, you're getting some pinching at the bottom of your squat. Well, okay, what mobility deficits do we have? Let's try and open up your hips a little bit more at the bottom. You're kind of crashing in a little bit, right? Causing hip impingement. Did that fix it? Yes, it did. That could have avoided you pinching your hip for 6 weeks straight, right? And getting like a tendonitis, last type of impingement, right? It was just something simple that you wouldn't have picked up unless someone pointed it out, right? And those things happen across the board all the time when you have guidance like that.
Yeah, I think that is like such a good point. So talk to people a little bit, because I am really excited because you have made it so easy for doctors to refer to you to keep their patients healthy in this like amazing program that you guys have going on at Kinetic. So can you talk a little about that?
Yeah, so Kinetic Westchester is inside of a health club, right? ACAC, which is Atlantic Coast Athletic Clubs, right? So it's a great facility, and through them we reach out to local doctors, right, who are looking to get their patients the resources they need to get healthier. So, for example, if someone has type 2 diabetes, they've just been diagnosed with type 2 diabetes, and the doctor is like, hey, listen, this is reversible, right? We caught this early. We're going to put you on this medication. We're going to start testing your sugar. You need to get some diet and exercise going. Here are some resources for that. That's a perfect example of where we come in and we say, hey, your patients who require a lifestyle change, whether it be diet, exercise, PT, weightlifting, whatever it may be, right? You can send them to us at Kinetic through ACAC. They'll get a discounted gym membership, right? So they can join the gym for 60 days for $60, which is a huge discount at ACAC, right? They get all the perks of the facility. They get to have 3 free personal training sessions to help get on track, right? Which is a huge, huge value just there, just to have 3 sessions to actually get a program together and start to get, some guidance to what you're doing. Because oftentimes, like we just talked about, people just show up in a gym and they're like, I don't even know what to do. I just know I have to be here, right? So they have that guidance. They get a movement screen through us where you have a doctor of physical therapy screening these different movements to pick out things like you just said. You don't have the mobility to squat down, you're going to get hip impingement. So you got to clear that up before we go and do that kind of movement, right? Which is twofold. It helps you reduce pain, and it helps you not get hurt so you can stay in the gym. If you go in there and you just start, you're like, man, I really got to get going. I got to get feeling better. And you start doing something that your body isn't quite ready to do yet, and you injure yourself, that puts you out of the gym. You got to recover from that injury, and it's hard to get the ball rolling, right? So it helps clear you for things that could hurt you in the first place, right? And the program also allows us to give you a lot of other benefits, especially with COVID going on. We're offering a free mental health screen through our partner, Sonare. So if you need any kind of resources, that first introduction with them, with a clinical psychologist, is free, right? And you can actually go talk to somebody and kind of get in the right mental frame of mind to meet your goals as well. So it's a great value, and it's something that we and ACAC are really passionate about, because it's really improving the lives of like our community. Like when you feel good, you do good, and if everyone feels better and is healthier, they're just better people, and your community is better for it. So it's one of those things that we're really proud of, and it's something to be happy that we're trying to just get more and more people involved in, because it's such a great value. It's huge.
I love it so much. And guys, it's such a critical step that we as a society need to take to make exercise an actual prescription that's doable, right? So it shouldn't just be that the doctor tells you go exercise, because you've got questions, right? Like, am I safe to exercise? Do I have injuries that are going to get worse? How do I do this safely? What type of program is appropriate for me? And the program at Kinetic and ACAC makes it possible. So I am really honored to partner with you guys. I'm sending you tons of people through this program all the time because it's amazing. So guys, you can ask your doctor about it if they're local, or you can call Kinetic, right? And you guys will get them set up with a screen. And
that's correct.
Awesome. So where can people find out more about you and your practice?
So they can look us up at our website, kineticptpa.com, our Instagram page, Kinetic PT, Facebook, Kinetic Physical Therapy as well, and our TikTok, which is starting to blow up as well. So if you guys like helpful short videos, check out our TikTok as well, Kinetic PT.
Love it. I love it. And guys, if you have more questions after this, direct message or comment. If you want us to do another one of these and answer more questions, let us know. We're happy to do it. But stay safe, stay healthy. Dr. Kresge, thank you so much for joining us.
Thank you.
Yeah, we'll talk more soon.
All right, take care.
Okay, you too.